If you are here in Lee County and Southwest Florida, it is a very rainy day, so I hope you're staying dry wherever you are. But thank you for joining us for our monthly Human Services Information Network meeting, our HSIN meeting. Today we are excited to hear from one of my colleagues here at United Way, Ms. Gail Holton. She'll be sharing information about top resources and areas of need here in our community. I should introduce myself. I'm a bad hostess. My name is Madison Mitchell. I am the Vice President of Community Impact. I know many of you on this call, but for those of you I have yet to have the pleasure to meet, I look forward to collaborating with you, and I thank you for being here and being part of our network. Today, Gail will be presenting, as I mentioned, on 211. We'll have some time for some Q&A with Gail after her presentation. And then we have some time built into our agenda for any report outs that the agencies, our partners here, would like to do. You'll be able to raise your hand. We'll go in the order that those come in, and that'll be an opportunity for any news, anything different for your organization, if you're launching a new initiative, or if you're new to the organization, you want to introduce yourself to the network. And then we'll have a little bit of time that we will just randomly assign breakouts. So it'll give you a chance to
we're on a meeting. It's okay.
network.
She won't mind.
Nope.
Just it's okay.
I don't mind. It's totally fine. I don't know what I don't mind, but if you're not speaking, if you could go ahead and mute your audio there. But we will have some breakouts at the end of this for you to talk a little bit more one-on-one in small groups. So without further ado, I will kick us off by turning it over to Gail.
Good afternoon. I truly appreciate the opportunity to speak with you about 211. Most of you have probably heard of 211 since you're part of our partner network agency, but you may not really know what 211 function and their foundation is. And so I kind of wanted to start there a little bit. 211 is a national organization. There's about 200 211s across the nation. There's 11 of them in Florida themselves. And I really like this definition. 211 is information and referral, which is the art, science, and practice of bringing people and services together. And that really defines what 211 is for. We're a matchmaker. People call us who have needs and are trying to find resources, and we have resources and we match them together. So I love that definition of what 211 is. It really is just a way to bring people and the resources they're looking for together. I'm going to attempt to share my screen. I say attempt.
Looks good, Gail.
Okay. So we cover Lee, Hendry, and Glades. I think you're probably very aware of that piece of it. The 211 team has 24 positions, and we do a number of different things. We have the Mission United program, which is our veterans-related program. We are embedded in the Lee Health clinics. They're federal lookalike clinics. And so we have team members who are actually there. We have a team member who recently, just this spring, we stationed a 211 team member out in the LaBelle United Way hub, because there's such a need in that area that we thought it was very important to actually have a resource specialist in that area. And then our biggest population of our team members are here in Lee County, because that's where we do get our most calls. And on my slide here, I've put the 988 crisis line, and those are just blank positions right now. We have taken on the opportunity to become a 988 crisis line. So we are actively working towards becoming that crisis line. And so we will fill those positions as we get to that position, and we will be able to help answer some of the crisis calls in our community. Currently, those are going to the Tampa Bay area. So we thought it was important to have the person answering the crisis line in the community that the person's calling from. In 2023, we provided over 75,000 contacts. That's people calling us, people texting us, people emailing us, using our chat, using our website. But we were in contact with over 75,000 people who are looking for some type of resource. We managed 15 direct assistance programs, and those are programs that help us support the community with financial needs if they need them. And so we were able to assist 2,429 families with about $900,000 in assistance. And that's helping them with rent payments, that's helping electric payments, that's helping them if they are looking for assistance with other type of financial needs. What mainly people call us for are their financial needs, the rent, electric, that type of thing. Obviously, at the beginning of the year, when it's tax season, we get numerous calls for tax assistance. And then we get a lot of calls for homeless needs. People who are homeless, they're living in their cars, they may be living on someone's couch, they may be getting evicted, that type of thing. And then we help with food assistance as well. People looking for food pantries, looking for assistance with getting on food stamps and that type of thing. With the VITA, we partner with them to actually do the VITA appointments. So if someone's looking for an appointment with one of our VITA volunteers, they can call 211 and we will set them up with an appointment. We did 5,000 appointments between January and April in order to set up appointments. And we're just one small area that actually sets up appointments. VITA sees many more people than what we set up. We have a partnership with ACT, Abuse Counseling and Treatment Center, to take our after-hour calls. So our 211 is answered by a live person 24 hours a day, 7 days a week. Our team, the United Way team, is basically the Monday through Friday, 8 to 5. And then ACT picks up after hours and on weekends. And then our team will support ACT on busy days, on holidays. Recently, when our tropical storm Debbie was going through, we were supporting in case there was a need for extra calls and people looking for assistance for that. And then we have a partnership with the Emergency Operations Center where 211 becomes the storm hotline. So if they activate us, and then we are now the trusted source for information on the storms, where the shelters are, where the sandbags are. If after the storm, what's open, what's closed, that type of thing. So we are the trusted partner for that. We also assist some employers in the community with their employee assistance programs. They provide United Way funding in order to help their employees. And so we become a neutral way for them to assist their employees and have it not be looked upon as being something with any favors were played or anything like that. The employee will call us. They identify as an employee of one of these organizations, and then they are vetted just like any other caller. We make sure that they have the resources they need, but then we also have the ability to help them in some other ways because their employers have set up this with us. It's a really nice program that allows employers in the community to give their employees a little bit extra assistance, and we partner with them to do that. We have what we call direct assistance, and we see ourselves as a last effort if someone's in need of assistance and can't get it quickly from somewhere else. A case being somebody's electric was turned off this morning, and we can provide them resources to get their electric bill paid and get that type of thing, but there's a time lag on that. And if it's, a heat index of 100 degrees outside and you're 93 years old, being without air conditioning is an issue. And so we have the ability to help bridge the gap and get their electricity turned back on while they're applying for the community programs that do that on a regular basis. We have some criteria. It must be a crisis that happened within the last 90 days. It has to be for no fault or no action of their own. They have to be willing to provide us documents and proof of the crisis. The provider has to be willing to work with us to take a third-party check and to take a commitment from us that we will pay. And us helping has to not just postpone a crisis, it actually has to resolve it. So if someone's having ongoing financial needs, we're not able to assist. We're going to try to connect them with a partner agency in the community that can help them resolve their ongoing issues. We can't pay for a hotel for someone for long periods of time. But if they're actually in a situation where they're moving into an apartment on Monday and something's happened and they've been evicted on Friday, we might be able to assist for over the weekend. We do a full assessment on these people, and they have to exhaust the resources that are available in the community. We are definitely the last stop to help. our Mission United program. It's a collaboration that we use our existing 211 resources and our partners in order to support veterans. We currently have about 140 resources in our database that are just for veterans. And it allows us to not only provide the resources that all community members would get, but also resources for veterans. In 2023, we assisted 1,140 veterans with needs. Their needs are pretty much the same as what anyone's needs are. They need assistance with financial assistance, with rent, electric, homeless type things, tax preparation, assistance with their water payments. A number of our veterans also need assistance in connecting them with the benefits at the Veterans Administration that they're eligible for and entitled to, and they may not know how to navigate the system. So our care coordinators will actually help them navigate the system and get them connected with the person at the VA who can actually help them get those benefits. We hold 5 stakeholders meetings. And that's where we bring together the community partners who work with veterans. There's a number of agencies that they do a lot of other things, but they have a veteran program as well. And we bring all these stakeholders together and we talk about how we can help veterans, what we can do as partners, who's able to cover what type of need. And then a lot of times after the meetings, we kind of do that networking, and we all usually have mutual clients. And so what we try to do, if there's a way to sit and talk and work out helping a single client, that team will do that after the meetings and be able to move that forward. We're very blessed to have Bonita Bay Veterans Council as one of our direct assistance donors, and they work with us on a daily basis to provide assistance to veterans. And they will help us be able to get a veteran's car repaired, help us be able to get a veteran housed, to pay, first, last month deposits, to help with electric, and some other unique types of things that they're willing to help with. Unfortunately, we get a number of veteran spouses who call, and the veteran has passed away and they're in need of assistance to help with burial costs, to help with some of the things, because there's a misconception that the VA covers all of that. They do cover some of it, but there's a pretty good size piece of it that the family then has to cover. And so Bonita Bay has been just amazing in helping us help those widows, help those widowers cover those costs for those funerals for veterans. I said a little bit about our partnership with Lee Health. We have 4 clinics. They are in the Cape Coral, Dunbar, North Fort Myers, and then at the GME clinic, the General Medical Education Clinic in downtown. They have federal lookalike clinics. And these are clinics that it's a sliding scale, or they'll see you for free. If you truly don't have any money, they will see you. And what Lee Health has recognized is that having a resource navigator with them in the clinic helps a person who has a medical need, that there's also social needs attached to it. And we like to use the example that if someone comes in and has diabetes and they're having a hard time controlling it, the medical side can certainly get the medication, they can help them with all of that, but the access to healthy food is also a piece that helps you stay healthy if you have diabetes. And we can help with that. We can help them apply for food stamp applications. We can get them on the SNAP benefits. We can help them find a food pantry that has fresh food. We maybe can help them find a couple of different food pantries that they can alternate weeks so that they are able to get the healthy food to eat that helps maintain their diabetes as well. And so having us as a partnership in the Lee Health clinics, we're able to look at that person as a whole, where they're looking at the medical side, we're looking at the social service, human service side, and between the two of us, that we're able to actually assist that person with the needs that they have to keep them living in the community healthy and being a good member of the community. 211 has some interesting grants. We work with the Crisis Center Tampa Bay to work on what is called the First Responders and My Florida Vet grants. They're basically there are national helplines for first responders and for veterans, support lines. And they are trying to ensure that if a veteran or first responder from our area, from Lee County, from Glades County, from Hendry County calls, that they have the resources that they need in their database in order to provide that person a resource locally. And so we, on a monthly basis, provide them with resources that are related to first responders and veterans so that that national database stays updated with our information. So if somebody was to call the My Florida Vet Helpline, and they said they're calling from Lee County, they're able to access the resources right here in Lee County instead of giving them ones that may be in Jacksonville or out of state, but they can find the ones in Lee County. So we work with them to make sure that our veterans who may call that and our first responders who may call those lines have access to the information that's local to them. We also work with AARP and United Way Worldwide for a caregiver grant. And what that does is we actually screen our callers, finding out, are they family caregivers? People don't even realize that they're a family caregiver, that there's resources for them. There's a lot of people caring for loved ones, and they just do it because they feel it's the right thing to do. But there's some resources for them. And so we screen them. And if they identify as a family caregiver, we try to provide them some resources through the ARP, through some other agencies that can actually support them as being a family caregiver. We're part of the Lee County Partnering for Results, which probably a number of you are as well. And we provide information and resources and things to them as well. We work with the Summer Break Spot, which just ended. It's a program that over the summer where children under the age of 18 can go to schools and get breakfast, lunch, and snacks. Recognizing that when schools are out, there's a population of children who aren't able to get enough food. And so anybody who calls 211 during the time that that program is open, and they say they have a child under the age of 18, we immediately tell them about this resource so that if they didn't know about it, they can access it if need be. And if they did know about it, we've reminded them that it's there, and it's a way to help them stretch dollars and make sure their children are getting meals all summer long. We also work with the Department of Corrections in a very unique way. We also screen for callers who may be being released from the state prison system. And when a prisoner is released, they are actually given information on the 211 network in Florida and told that if they call that network, that we can help them get resources. We can help them find resources for where they're going to live. And so we get calls and a person will identify that they were given that information from the Department of Corrections. And we work with them trying to make sure that they find housing, make sure that we can connect them with like career source and places so that they can succeed when they are released from prison. They can succeed in the community that they're going back to. We have a database that has over 1,300 active records in it. We update it at least annually. Generally, it's being updated every couple of months because you as our partners are very good about telling us when programs open and close, when you've run out of money, when you've got new money. Every time you tell us those things, we update our database so that it is accurate and as current as we can possibly be. I actually have 3 full-time staff members whose job it is to keep our database updated and accurate so that anytime it's used, we know that if we give a resource to somebody, they're not going to call a phone number that's disconnected, and they're going to call where a program is actually what they're looking for. And we have 145 veteran-specific resources. I'm going to show you how to access our database. The same one that my team uses is able to be accessed through our actual website. So if you go to the United Way website, and I'm hoping that this, if I go to it from here, it shares. Can you see it?
You may have to stop sharing your screen, Gail, and then reselect which screen you want to share because it doesn't usually do the pop-ups.
Darn. Okay, I didn't practice that.
Or slide what you want to see over the slideshow.
Slide what I want. Oh, who told me that's the idea? Now I've lost it. I'm not good at this kind of technology. And I apologize for that. Okay. If I go to our website, right? And I apologize. Our database has a front and back side facing, and so we're able to, what we see, you can see as well by going to our website, and now it's not even going to the website.
Gail, I have our website up. If you'd like, I can switch to mine and then we'll switch back to you. Does that
That'd
work?
be
And then you
awesome.
can just walk me through.
Perfect, thank you, Madison, I apologize.
Okay, if you want to stop sharing your screen and then
Stop
I'll
sharing.
pick mine.
Okay, stop sharing.
Okay, just give me a second to do that.
And this is something that if you have a client sitting with you and you just need some quick information, and especially if you think that they probably won't call us, you can at least start the process by doing this. So this is our website, and if you go to Get Help on our website and click Get Help, and then as you scroll down, you have access to our 211 data inclusion exclusion policy, which those are the people that are allowed in our database. And then as you go down and you see where it says start your search below, that's the actual database that we're using. And so you're able to, if you were to put like in the search line food, and you go down and it tells you what kind. So if you're looking for a food pantry, so find food pantries. Sorry, Madison, you're getting a crash course in the database, food pantries. And then if the person says they live in Cape Coral, you could put in the city of Cape Coral, or you could put in the zip code, or if you're just looking for everywhere, this one came back with 51 results. And so there's 51 food banks that are just generally in our database. If for some reason you want to just print that list off where it says make PDF of the search results, if you do click that, and then when it comes up, you're going to have a PDF list of all those food banks. I always caution people when I tell them about this. It's a nice feature, but we're always updating the food banks. If you print that off today and keep it, 2 weeks from now, it may not be accurate. So it's one of those things that it's nice to have the ability to do, but it may not be something you want to do and keep for months on end, because we're always updating those resources. So if you wanted to go back down to where we were, Madison, and if you click on any one of those, the red part of it, that's going to tell you about St. Margaret's Church Food Pantry. It's going to tell you who gets it, what they can get. It'll tell you what it covers. That's in Hendry County. It'll tell you the hours of when it's open and when it's available. It may give you some other information about it. There's no eligibility. If you know that you had to live in Clewiston or something like that, it could put that in there. But it's going to give you enough information that if you're sitting with someone and you want to give them some quick information, you can access it as well. Always can tell them to call 211, but we all know there's some people that you're not quite sure they're actually going to do it. This is a way for you to at least give them something before they walk out of your door. So you would use just whatever basic term, if they're looking for rent assistance, if they're looking for food assistance, help with electricity, that high level basic need is what you're going to put in, and then you can start narrowing it down from there. So it's a way for you to actually help your clients, electric bill assistance, all of those different things, and then narrow it down a little bit and see who's doing. And there's people that you don't even realize are doing things. There's lots of churches that will assist with the electric bill for a very specific area in the community, a very specific zip code. There's that if the person you're working lives in that zip code, that's a resource that they can tap into. And so that's kind of a way for, especially we want them to call 211. I'm not trying to have you not have your clients and your people call 211, but those people, especially if you don't think they'll probably follow through, if you can hand them something, at least they've gotten something. And it's a good way for your own agency staff to be able to do it. It maps it for you. So if you're trying to figure out where that place is, you can pull up the map. I apologize, my phone's ringing. You can pull up the map and see where it's actually at. when you're inside one of the resources, so like if you clicked on the red thing again, it'll say map resource in there, a view map of that location, and it's going to give you street addresses. And we will actually, sometimes when we're talking to people on the phone, we will pull this up and give them directions of how to get to the county human service building. You know, they'll say, well, I'm on this road, and we will actually help them navigate to it sometimes by using these maps. So it's a way to help the staff help the person who's calling as well. And like, here's a good one too. That was Live Heap, big red letters, no paper applications. Those are the kind of things that you can learn about the resources in that regards. So there's 1,300 resources in there. We don't even know them all. My team doesn't know them all. They all have a handful of ones that they know assist and who they are and what they do, but then they will just search the database to see who else is in there. Every time a new resource is added, we have a way of informing our team that they're there. Every time there's a change, so if you no longer are doing a program, you let us know. We make sure we have a place in our side of the database that it flags it and says, you know, the county is no longer taking paper applications, things like that, so that we're giving as much up-to-date recent information as we can to the people calling us. But this is an awesome way for you to actually help as well, or just for you to educate yourself. If you're looking for something on your own, if you're trying to help someone, your neighbor or someone, because we all know we get asked those kind of questions, this is a way for you to kind of assist them, especially if they're not willing to or not ready to call 211. Questions on the database? Thank you, Madison. I appreciate you helping me with that.
Teamwork.
I have a question about the database.
Absolutely.
When you pull up the list, is there a way to like PDF or export the list, or do you have to sort of screen grab, or what's the best way to do that?
The full list, when you pull that up, if you hit the go to make a PDF, make PDF results of this, that's going to pull up a PDF completely. And then when you're on the inside of it, and I just thought of something I forgot to tell you, when you're inside one of the actual resources, there's a place where you can change the language. So if your person that you're working with speaks Creole, you can actually go up to the top there where it says select language. On the top, there you go, and click on that and choose Haitian Creole or Armenian. There we go. That resource is then in Armenian, and then you can actually PDF this and hand that to them in Armenian. So it kind of helps if you know they can speak Spanish, but they really would prefer to see it in Spanish. You can kind of work through it with them and then give it to them in the language that they are most comfortable in. But you can PDF it by just the make it a PDF button. And it'll give you all of it in a PDF and then be able to print it off. And I'm going to caution again, because Linda Hafner would slap me if I didn't. It's only as up to date as what we have in today. So if you make hard copies of something, please always check to make sure that nothing's changed prior to giving it out to somebody. So if you're going to print a whole list of food banks in the whole community, those could change on a daily basis because we're updating any changes they give us on a regular basis. So just do a quick check before we send a client to a food bank that's no longer providing food on Tuesdays and now it's on Thursdays, things like that. Any other questions?
Hi, Gail. It's Angela.
Hi.
Hi. I imagine that some of the agencies on the call are maybe going to research themselves in this. And so if they look at their record and see something that maybe is no longer current, what's the best way for them to give you that information?
We have a actual resource department, and they have an email, and it's called, now I'm going to forget it, resources@unitedwaylee.org. They can email that. You can always just call 211 as well, which I always tell people, just call 211. It's the easiest thing to do. If you have a moment to talk, and tell them you want to update your resources, and they will get you to one of the resource team. They can do that right on the phone with you. They'll verify it, and then it's over and done. You don't have to worry about trying to send an email and waiting for a response or anything like that. So you can always call, or if you feel like, you prefer to it's 211 resources at unitedwaylee.org. I just got a message from my resource team. I always forget theirs, but they're happy to, talk with them, work through it. And when they have them on the phone, they'll verify other stuff as well to make sure that it is right, because we really do want it to be correct. And we count on you guys to let us know when things change. And we don't mind. You can call us today and tell us the program's open, and call us tomorrow and tell us, unfortunately, we've run out of money, it's closed. We're fine with that. That makes sure that we're giving the most current updated information to our callers, and our community's getting the most current information.
And one of our 211 team members has dropped that email in the chat. So if you want to copy that for your records, it is in the chat.
Thank you, Lynn.
Gail, did you have any more slides on your presentation?
Nope,
there?
that was it. That was it.
All right. So at this time, any final questions for Gail about 211, about resources, what we're seeing with our calls? All right. Well, Gail, if you wouldn't mind putting your contact information in the chat as well.
Absolutely.
Just so if someone comes up with a question after this, they're able to reach out to you directly.
Absolutely.
All right. Thank you. So thank you, Gail, so much for that information. And, I actually did not mind sharing that at all, sharing my screen, because I learned about that translation feature. I have definitely used our search engine, of course, in-house, but I never really paid attention to that translation feature at the top of the screen. So 8 years in, I'm still learning things as well. So thank you very much for that. We are seeing that can I get a copy of the presentation? Yes, we will email that out as a follow-up. Tina will send that out to everyone who attends today. A little housekeeping before we move forward. I do want to let you know that Tina has also put in the chat the link to our HSIN email list. So if you received this meeting, maybe one of your colleagues forwarded it to you, and you were not on the original distribution list, go ahead and click on that HSIN email list. It's a Google form. We'll just get your contact information, your name, your title, your organization, so that you can be included in all the invitations for our future HSIN meetings. So at this time, I would love to open it up to all of our attendees for any updates about their agency, any program updates, staffing changes, maybe an opportunity or a resource that they would like to share with the network. Any updates at all, and you can do so by raising your hand, and I will call upon you in the order that they come in. So we'll start with Angel.
Good afternoon, everyone. We're happy to announce that we have partnered with the Community Cooperative, and they have moved their mobile food pantry to the Bonita Springs YMCA. So for the second Tuesday of each month, there will be 2 trucks serving food, produce, as well as hot food. The hot food is for individuals who are present, and then they are able to take food thereafter, and the hours start from 9:30 a.m. to about 11:30 a.m. And all you need is a government issue ID to receive food.
Excellent. That's very exciting. I love that collaboration. So thank you, YMCA and Community Cooperative, for that. And Angel, if you want to just introduce yourself real quick.
Yes. And sorry, let me turn on my camera here real quick. Good afternoon, everyone. Angel Cerritos, District Exec for Lee County. I oversee the Bonita Springs and Fort Myers YMCA.
Thank you. All right. Pamalia.
There it is. Yes, good afternoon, everyone. My name is Pamelia Curry. I'm the new administrator with Healing Stitches, working with Lucy Garcia. Just wanted to introduce myself, and I'm excited to be a part of this collaboration, and I look forward to working with everyone and networking and learning everything about the healing stitches. Yes.
And I just also want to introduce myself. My name is Cora Romero. I am an MSW intern, and I'm so excited to meet all of you guys and learn about what is out there in our community so that when we have our clients and we're talking with those families, we have those resources that they so need in order to meet their needs. So super excited to be here.
Thank you, ladies, and very grateful for the work you all do in North Fort Myers. So appreciate you. Heather, good to see you on here.
Hi, thank you. And thank you for inviting me as well. So I am Heather Hackett with Local Relief. Just like you guys, we try to gather all the resources and try to funnel people in the right direction. I am new, so it is a social media app that also happens to have resources as well. So we like to funnel people in and really distribute them where they're needed. And then also we have the social media component as well, which I think is really going to come in handy. So even there, we really like to have all the organizations that can help. I mean, obviously you guys are at the top of that list. So anybody that does want to, make sure you are a part of that, please look at the app, make sure you are on there. But also if you do want to be included and you are not, please let me know as well. So that's Local Relief. You can download in the App Store and Google Play. But I'm just thrilled that you included me. So I just want to say thank you. And I'm sure we will work together soon.
Excellent. And Heather, I think it's important to note, since most people here are Lee County, that Local Relief is for the whole state of Florida too. So it's wherever a disaster or resources needed.
Yeah, absolutely. So now we're just focused on Florida. We have an MOA with the state. We're also looking at other states, and really, I mean, wherever the App Store and Google Play is, which is nationwide, we can stretch there as well. We just the biggest thing is the reach. So being new, we just want to, again, tell people we exist. And then it's a platform for everyone else. It is for like the neighbors helping neighbors as well. So they may be at that spot where they just need a little bit of help, where it truly is trying to connect, neighbors together and people that have to people that need. So.
Thanks, Heather.
Absolutely. Thank you.
Any other updates or announcements for the network? Lisette, yes.
Hi, my name is Lisette Ortiz. I'm the Volunteer Center Coordinator here with United Way. I just wanted to quickly plug in that I do help with running our volunteer portal, which is a site where we will post volunteer opportunities for any of our nonprofit partners in the community. So if you need help accessing that, getting added onto there, if you had an account and need a new password or anything, then you can reach out to me. I'll put my email in the chat and we can get you set up on that website. It's a great way to promote the opportunities that your agency has and just to continue spreading the word on what you guys are doing. So thanks.
Thank you, Lisette. And Maria Espinoza from Fish, because we have two Marias with their hands raised. So
oh, look at that. Thanks, Madison. I had a share out and then I figured there's a group of hero people who've had to be handy with resources. So a question of, I know anybody at chat can help me with it. We have a group of volunteers doing some cleanup around the island after this last storm. Luckily, nothing too bad. Had a few houses with minor flooding, but what happened a lot to our community was just a lot of landscaping and debris that our older adults need help with. So we were able to get a volunteer group together. But if anybody has had this experience in their community and knows a resource for, or even a business that likes lending out tools, it's just not something we do on the day-to-day here. So if anybody knows that, I'm welcome to any suggestions if you've done this before at your agency.
So Maria, just to clarify, so you're looking for any group that would be interested when it's like a minor cleanup. Is that like just doing some general debris cleanup after some of these lesser impacted storms?
Yes, and we actually got a group. We partnered with FGCU, but if anyone has any idea of how to acquire some tools that would be handy, just like no power tools, just very basic tools that the volunteers can use for this post cleanup.
Like rakes and gloves and stuff like that. Okay.
Exactly right.
And we will pass that along to Gifts in Kind too, just in case they come across any of those items.
Thank you.
Okay. Before I move on to our other Maria, does anybody have, if anybody has a resource that Maria could access, or you know of something that may be related or helpful, if you want to put it, let's see, Cindy put free lending of tools. Oh, the tool bank. Yes. I know they do a lot of power tools, but there may be some items there too. So, all right, it seems like Cindy, you're connecting with Maria. So excellent. All right, and then Maria.
Yes. Hi, everyone. My name is the other Maria, and I'm from Healthy Stars, Southwest Florida. And I have, maybe it's not linked to the resources. I don't know if you guys are familiar that we have our diaper bank. So that could be something that someone that is affected either through the storm or in any situation that they could be and they're in need of diapers. We have different locations that I'm happy to share. If you need, I'll put my link, my email on the chat, and you can email me and I'll send you that whole list throughout the Lee County. And also we do baby showers for the community, and we have 2 coming up in Lee. So the first one is September 27 at the Family Health Center's location in Summerlin at 11. I have flyers for that as well. And then the next one will be in October. So we know that since Lee is so big and there's so much need, we have 2 baby showers, because I do one every month. So we have 2 baby showers back to back in Lee. So like I said, September 27th and then October 17th. It will be dates for the baby showers. I don't promote one until the other one it's over. So we're currently promoting the one in September. And they can either call our office or send me an email if they want to register. I'll put that in the chat so you can have it if you come across anyone that might need it. It's open to the community. They just need to call and register. That's it.
Okay, thank you. And I did see that Michael Overway from our partners at the Homeless Coalition, they also have a Continuum of Care meeting coming up on September 19th. Castle will be talking about housing is healthcare. So if you're interested, the contact information for that meeting is in the chat as well. And at this time, I'll call upon Marissa. Oh, Marissa, I'm sorry. We can't hear you.
Can you hear me now?
Yes.
Okay, awesome. Good afternoon, everyone. Marissa Houston from Lutheran Services, Florida. If you're not familiar with what we do, we are prevention services for youth ages 6 to 17. So we have a few different programs. So we have a residential facility here in Fort Myers named Oasis Youth Shelter. We offer community counseling. We offer SNAP, which stands for Stop Now and Plan. It's a behavior regulation group that's more so for our little kiddies. And as of recently, they have expanded into targeting father and father figures. So if you have any families that you feel like can benefit from any of our services, you can always refer. And then as of recently, we also have branched out into a completely different area of service, which is helping people that are at risk for homelessness or dealing with homelessness and trying to exit out of that situation. And so we recently adopted a project called the Sharit Cares Project, which is named after Sharit Panino, who was our regional director, who passed away in November of 2021. And so if you have any families, youth, and young adults that are ages 6 to 21 that are dealing with homelessness, either at risk or currently in homelessness trying to exit out, you can go ahead and refer them to our services. I will link my information in the chat for anyone that has any questions or need any further information about our services. Thank you so much for the space.
Thank you, Marissa. Any other updates? Okay. Let's see, Lisa, monthly leadership luncheon for civic, business, and nonprofit leaders in Estero on Thursday, August 29th, which is crazy that that is next week already. Doors open at 11:30. There's a link in the chat for that as well. So thank you for sharing that, Lisa. And I would also like to share that our next HSIN meeting in September, I believe it's September 25th, but Tina will be sending out the information following this meeting, so you can save that date. That will be done in partnership with our friends at the Collaboratory. They will be their new chief philanthropy officer will be presenting on leveraging strategic foundation support. So that will certainly be an interesting conversation. So hopefully you'll be able to join us next month. We are going to now move to our small breakout sessions. So these are just randomly assigned. You will be automatically moved into the breakout session. We'll do these for about 15 minutes or so and just allow for some one-on-one conversation. If you want to discuss any challenges your organization is currently facing, or a challenge in a specific program, and you want to brainstorm with your counterparts at our community organizations, or just share a recent success that you've experienced, or anywhere else the conversation takes you. This is really kind of just that informal networking period that I know we all miss from some of those in-person meetings. So with that, Tina, if you will go ahead and break us up. There will be no coming back to